Hi everyone, my name is Grace Paul. I do pediatric pulmonary and sleep medicine at Nationwide Children's Hospital in Columbus. It is an honor for me to be talking to you about vaping and vape-related morbidity. I'm also grateful for this opportunity to be the e-cigarette champion for the Ohio AAP chapter. So as you can see in this cartoon, there are three people in this barrel: the smoker, the chewer, and the vape pen user, each one thinking that they are safer than the other one, but ultimately all of them ending up in the same fate. I do not have any conflicts of interest to disclose, and all my slides are purely based on research and not personal use. So this is a good time to talk about vaping because in the last 1.5 years, COVID-19 has taken over every aspect of our medical care and time and effort. And so now that things are settling, it is a good time to readdress other medical issues that have affected our pediatric population. The outline of my talk, I'll be talking on the epidemiology of vaping in the US, mainly focusing on Ohio, talk briefly about the products, and then as a pulmonologist, I will be talking a little bit on e-cigarette related lung injury, and then briefly on non-pulmonary morbidity. And then I'll be focusing on COVID-19 and vaping, and finally on the resources that are available to help prevent our kids from starting to vape, and then what are the resources available to help them quitting, briefly touch upon racial disparities, and then how to equip parents to help with this vaping problem. So the global data on e-cigarette use, you can see that this is from adult information. So from 2011 to 2018, there has been a significant increase in the number of vape products. Unfortunately, USA has the highest market for vape-related products compared to other developed nations. And this has been extremely expensive to our infrastructure. So talking about the US specifically, each day it's very sad to see that at least 1,600 youth smoke their first cigarette and more than 200 start smoking daily. You can see that there is a difference in the numbers from 2019 to 2020. So the number of kids who used vape products in the last 30 days was 5 million, and it has come down to 3.6 million. The number of high school students who used vape products was 28% and now down to 20%, which is a good decrease, but still if you see, it is 1 out of every 5 high school students has used some vape product. And middle school, again, 10% down to 5%, but 1 in 20 kids is using any vape-related product. The daily use, again, 22% among high schoolers and users, and 9% of middle school users. And you can see that there is a high number of those kids who use multiple products. So earlier there was a difference in the male to female ratio. The boys were using a little bit more, but recent data, the girls are actually catching up. So this is data from 2021 from the National Youth Tobacco Survey. And you can see that 1 in 4 kids are still using e-cigarettes every day, most commonly the disposables, which are flavored. These are graphs that you've probably seen, and this is the current tobacco use among high school students. So from 2011 onwards, you can see multiple products, any tobacco product has increased a lot. And this was where we were in 2019, before COVID hit. But then I just added some 2020 data, and you can see that there has been a drop. And if this continues to drop, that's excellent. But we have to see how things are when everything opens up, kids are back in school and things like that. So a couple of reasons why this has happened. We think that there's been a lot of new rules and regulations on vaping, and including the age at which tobacco could be used, a lot of restrictions to the retailer, and many rules regarding quality control. But also, I think there is COVID-19 has played a big role in reducing this consumption of vape products. And we will talk about that later in the slides. But overall, it's a good trend that all the numbers are decreasing. And this is the same for middle school students. I really want to focus on middle school students because this is an age group where we can actually make a difference. Once they're in high school, it's very hard to change some mindsets, but middle school, the kids are still young, the kids are still coming for routine pediatric clinic visits. So this is a time where we can actually talk to them and make a difference. What about Ohio? This is 2020 data, and it's actually pretty alarming. So if you see here, in Ohio, high school students who smoke, so it's almost like 5% compared to US data of 4.6. And boys, high school students who smoke, 10% compared to 5% among the US data. High school students who use e-cigarettes. So Ohio is at 30% compared to the US 20% data, which is a reduced number. And then number of kids who become new daily smokers, 4,000 compared to 1,600. And premature death, you can see it's almost 260,000. So you can see that the data in Ohio is pretty concerning, and we are the people who can actually try to make a difference at least. And so it's not only the usage of vape products, but you can see that the number of hospitalizations for EVALI, and then the financial and economic burden on the state's infrastructure is also getting hit. Briefly on electronic nicotine delivery systems, you're probably aware of these. There are multiple different varieties of products, and each one keeps changing. There are upgrades, and we are not able to keep up with this. But one of the most common ones or popular ones is this Juul, which is a pre-filled pod. And they are of different generations. The first generation are these disposable e-cigarettes. They do look like cigarettes. The second generation is e-cigarettes with pre-filled or refillable cartridge. Third one is these tanks or mods where you can actually have a larger volume of the e-juice filled in. The fourth generation is the fancier ones where nicotine salts are used, which is less irritating to the throat and so therefore more preferred to use. And this is the Juul with different flavored cartridges. In preparation for this talk, I did go and visit a vape store, and you can see now this is a fourth generation pod mod, and you can see it just looks like a flash drive. So it's very easy and for anybody to hide it when they're going to school. Briefly on e-juice, there's multiple varieties of juices or flavors that are available, which are very captivating to this young audience. And it can either be nicotine-based products or it can be cannabis-based products, which are a little bit more expensive. But the flavor is the biggest appeal to teenagers, and that's where the tobacco industry spends a lot of effort in trying to attract the kids. This constant debate on whether which is safe, cigarette versus the e-cigarette. I like this cartoon because here it's a cigarette pointing hands at an e-cigarette saying, he's the America's public health enemy number one. There is a lot of argument on why vape products are better. Basically saying that it's safer, cleaner, less expensive, and it's generally cooler to do a vape product compared to actual cigarette smoking. But we know otherwise that in a cigarette, there are all these different chemicals that are coming out. It's a known poison compared to an unknown poison. So in a vape product here, this graph also shows us what's the actual anatomy of a vape product. There's a battery, there is a heating coil, and once somebody presses a switch, this liquid here or the e-juice that's here gets heated up, aerosolized, and then that's what the person inhales. So you can see that there's a lot of other chemicals again in this vape product also. So when we had visited a school and talked about vape products, kids were listening. But then when I mentioned that, Formaldehyde is the liquid that we use to embalm dead people. That got their attention. So, sometimes we may have to scare kids a little about what they're inhaling. And then this is a big graph of, each of those products, what do they cause? So main things are carcinogenic, a lot of airway irritation, respiratory infections, and a lot of lung damage. Briefly talking about EVALI or e-cigarette or vaping product use associated lung injury. So the main pathogenesis, again, this is a very important concept for any pulmonary doctor in terms of delivery of medications to the lungs. So it depends on the concentration, depends on the particle size and the location of deposition. So in the airway, those are the larger particles that get deposited there. There is airway hyperreactivity, increased airway resistance. And then in terms of the mucosa, it's downregulation of the host defense, decreased antimicrobial activity, and increased resistance to bacteria. And then in the alveoli, you can see decreased alveolar development, high levels of particle deposition, and increased necrosis and cytotoxicity. So this is what is the pathology that happens. And then, so that causes EVALI. These graphs are from February of 2020 because after this, when COVID took over, this graph has now not been updated from the CDC. So you can see September 2019, exactly 2 years ago, was when there was the highest peak of COVID, of vape-related injuries. And then this number decreased, but we think it's mainly because of underreporting and focus on COVID. Within Ohio, again, it's now 1.5-year-old data. You can see there was no deaths, but then about 50 to 100 cases of EVALI were admitted at that time. And we still do see some patients admitted to Nationwide Children's. This is a cartoon which I thought was really funny. It says, "No, we cannot connect your vaping device to your ventilator." Those who get admitted, what is the common features among these patients who get admitted? They are pretty young, 50% are less than 24 years of age. They use nicotine products, and many of them use products that have marijuana or THC in it. So this is sort of the general demographics of the patients who are getting admitted with EVALI. Again, this is one patient who is unfortunately intubated, purely vape-related lung injury. From a pulmonary perspective, the hospital course, what happens to most of these patients? Generally, they are in the hospital for about a week. About 50 to 60% are admitted to the ICU. Almost 60 to 90% need oxygen. Sometimes higher support like high flow nasal cannula or BiPAP. A few 10 to 30% get intubated. And there are some rare cases of ECMO and then rare deaths also. So this is the general EVALI and what happens to these patients. And the culprit, the biggest culprit that we are aware of is vitamin E acetate that was found in the BAL of EVALI patients. The study actually, the healthy people were from OSU. And then this is a pediatric cohort where looking at radiologic features, radiographic features. And what you can see is a very classic pattern. There is patchy ground glass pulmonary opacities, subpleural sparing. So you can see it in all these images, subpleural sparing, and then ground glass nodules, and then with bronchial wall thickening and interstitial thickening. Non-pulmonary morbidity, again, a significant impact on neurocognitive development, high addiction potential, a lot of complications on mental health, cardiac complications with arrhythmias, and then poison, even like if toddlers who have accidentally ingested this vape juice have even died. And then explosions because of the battery and the heat. And here is a marketing team meeting talking about these explosions. What do we do about the exploding batteries in our cigarettes? Promote them as self-lighting. of course. Now talking about SARS-CoV-2 and e-cigarettes. So COVID really changed all our lives. And then in this image is just so ironic. She's wearing a mask to protect herself, but then she's vaping and inhaling that smoke again. What about this combination? Teenager plus vaping plus COVID-19. So because most of these kids were, at home, and there was a lot of high stress for everybody, there was increased risk factors for substance use. So they did look at all different substances, and there was an increase in most of them. So the stress, social isolation, anxiety, depression, boredom, all of these were factors to increase use of illegal substances. So where did kids get these supplies from? So initially, because all the stores were closed, there was a lot of street vape products available and a lot of online resources. And then it was really funny to see this online chatter by this self-proclaimed experts who talked about safety using vape products, how it actually protects them from COVID, and then how to use this COVID-19 pandemic time as a transition from cigarettes to vape products. And so that was a problem. There, like as you saw in the initial graph, there was a decrease in vape use following COVID-19. And so why do we think this is? So there was definitely reduced availability and access. A lot of kids and teenagers did worry about lung health, reduced peer pressure. So peer pressure is a huge factor to enable good behavior or bad behavior. But here, in this case, fewer opportunities to start or to continue vaping. Kids were home with their parents, so a little bit more parental supervision. And then another factor that was mentioned was that there's less stress due to online schooling. So are vape users more susceptible to COVID-19? The answer is yes. So this goes by epidemiological data and other information also. So initially there was a study saying that with every 1% increase in the number of vapers in a state, there was definitely an increase in the number of COVID infections and the number of deaths. And then there was a study done on almost 4,300 adolescents. It was a national survey, 13 to 24 years old. And here, what we can see is that the diagnosis of COVID was 5 times more likely among those who just used e-cigarettes, 7 times more likely among those who used cigarettes and e-cigarettes. The chance of getting COVID testing done was 9 times more among those who used both products in the last 30 days, and those with symptomatic COVID were like 5 times more likely among the dual users. So basically just data saying there is more vaping, more COVID. What about immunohistochemical data? So we know that in this epithelial cell, we have this ACE2 receptors. That's where the SARS-CoV-2 virus binds. And we also know that vaping or any tobacco product increases or upregulates the SARS-CoV-2 receptors. So in a person who vapes or smokes, these receptors are more, so there's more likely to have a COVID infection. It also, there is alterations in the mucosal immunity. Basically, the cigarette products damage the mucosa, increase susceptibility to viral infections. In this graph, you can see that those with a person with COPD who smokes has higher number of SARS receptors, the ACE2 receptors, compared to a rare occasional smoker compared to a non-smoker. The other factor that is important is youth behaviors, basically not wearing a mask or just hanging out together and vaping, sharing products. So there was a lot of exposure to getting COVID infection. What about the severity of COVID-19 infection? So as you can see in this nice diagram, there was impaired mucociliary clearance among a smoker versus non, increased permeability, just like we talked in the previous slide, and then a lot of hyperinflammation causing the cytokine storm. This specific protein has been implicated to cause the cytokine storm, and this production of this is augmented by smoking. So the tobacco users did have a worse morbidity related to COVID-19. And then the COVID-19 crisis was also the tobacco companies really like exploited. Here you can see you get a mask, you get a coupon, and you get a vape pen. This person was selling pick the top for essentials. So there's like toilet paper, hand sanitizer, mask, and vape stuff. And then this one was really like ultimate. A BD stick a day keeps the pulmonologist away. Yeah, sure. So going to the final part of this talk, what do we do now? We now know that it is a public health concern. So because there is now renormalization of smoking behavior, there's concerns for accidental nicotine poisoning and then passive vape exposure. So it is not fair for all these products and passive exposure to affect young kids' lungs. So the two main things that we need to focus on is one is knowledge, getting to know what these products are, what are the features, what is the law against this, and what are the risks. And then partnering with the correct people, the community, and the schools. So this was a business card from this law group saying, are you addicted to Juul? We can help. But this is mainly because they want to get money out of the tobacco company and not really help the patient. But this is not where we are at. We can actually make a true difference. So as pediatricians, what are some prevention strategies to help your patients avoid vaping? So first thing is to know the federal and state rules. So since 2016, the FDA's tobacco deeming rule confirmed their authority to all tobacco products, including e-cigarettes, as part of its goal to improve public health. So that was a big thing. And then since October of 2019, in Ohio, the Tobacco 21 rule came into play, which is under tobacco, no products. You have to show a card and you have to have IDs and things like that. And this is not just for tobacco, e-cigarettes, e-vapor. And then the Ohio Tobacco Program, as part of the ODH, has strict rules on signage, criminal offense for any person who goes beyond their allowed sales, and then higher taxation. And this itself has been quite effective. The American Academy of Pediatrics has done a great job in advocacy. The priority is prohibit all flavored tobacco products, including menthol and mint, regulate all tobacco products in the interest of public health. And so this is from the AAP news, where there is a judge favoring the AAP partnering with the FDA. And then this is another member of the AAP who helped support reversing the youth tobacco epidemic. So the main action statement for pediatricians, first is screen and provide prevention counseling, promote tobacco-free bans wherever kids may be, visit in the schools, in the park, in the library, any area, and do not recommend e-cigarettes for tobacco dependence treatment. So the public policy is decrease youth access to e-cigarettes, decrease youth demand, and then incorporate e-cigarettes into current tobacco-free laws and ordinances. And then it's great to have amazing AAP members who are advocates for our work. From a pulmonary world, the American Thoracic Society and the American College of Chest Physicians has also been very actively involved for education, clinical protocols, advocacy, research, and collaborative action. So now that we know our rules, what can we do practically? So it's improving screening and education in the office. Look at this, it's the first vape toy here. So the AAP recommends early screening as early as 11 years of age with age-appropriate conversations. And then they encourage this 5A model, which is ask, advise, assess, assist, and arrange follow-up. And then we always respect private and confidential discussions so that there is trust built between the doctor and the patient. In terms of education, it's very important to focus on the health risks of Diwali, like we talked about. for kids to know that there is an increased risk for severe COVID infection, and then also for them to know that the deceptive and predatory marketing tactics used by the nicotine companies. So yeah, this is a very apt cartoon where it's saying marketing to kids, don't be ridiculous, but look what he's selling: bubble gum, chocolate chip cookie, and then binky flavor. So focusing on education is also important to know, because here, what do kids, teens say is in their e-cigarette? So they just think it's flavoring. So then if it's just flavoring, why not use it, right? So their innocence is being exploited here. And then also the concern that it does not cause any harm. So you can see overall this graph is smaller. The e-cigarette concerns are for harm are much lesser than cigarettes or other products. So this is what kids need to know, the dangers associated with this vape products. Acknowledging the power of peer pressure. So we saw that peer pressure plays a very important role to help or put down a kid. So boosting a teenager's self-confidence and offering sufficient guidance to say no, even before starting, is a first step. So personal mentorship, family support, and trust remain very important. And then fostering positive future orientation, like what is your goal? What do you want to do in the future? That really, and motivating and providing resources really helps kids stay away from harm. So I really like this picture here. So one matchstick or one person stepping away can make a difference to the others. So it's a very powerful image. And then know the validated public education programs. So there are multiple programs available which we can access. Actually, there's so much of information online. So some things related to youth tobacco use. The first one is the Real Cost campaign, which is part of the FDA. And here it is it was a very valuable tool that started in 2014, and in 2017 they included e-cigarettes, and they have prevented a lot of youth usage, saved a lot of money, and they do include media support. The marketing companies are using media, so we also use media to counter. The Real Cost campaign has been very successful. The other campaign is the Campaign for Tobacco-Free Kids, which is also a leading advocacy organization. There is excellent information on each of these websites. Youth Initiatives is a project where youth are provided resources to create models or create protocols or education materials to help other youth not start. And so this is like empowering these young teenagers to help others. The other education program is the Truth Initiative, which is called the Safer is Not Safe, and a lot of good information on this one also. And then, of course, we need to know what is our local community and school advocacy programs. Talking about schools, what have schools done about e-cigarettes? So a majority of this in this graph is basically surveillance around restrooms where vape products are generally being used, and how teachers can be involved in this monitoring. But it's also striking that about 25% of schools do not do anything to survey or to watch what their students are doing with vape use. So now that we know ways to prevent a kid from taking a vape product, how would you, and unfortunately if they start using, how would you encourage your patients to quit, and what are the resources available in Ohio? So first thing is knowledge is power. So we need to know what we are dealing with so that we can counter it. So again, awareness and communication. So before this talk, we did go to one of the suburban schools in Columbus area. And when we surveyed the high schoolers about vaping, most of them were aware of vaping. They knew some of the products. They had seen somebody vape. So that part was, they already knew stuff. And they also knew that it was bad, but it did help with some peer stress relief or because of peer pressure, they started using and then they cannot quit. But what was really glaring was that the lack of awareness of quitting resources. Generally, when I asked them what they would do, they said, oh, we'll go to the guidance counselor. But then if you think, I don't think any of these kids would go to the guidance counselor and tell them, hey, I'm vaping, help me. So a lot of kids want confidentiality. So there is a big role for motivational interviewing and open communication while we ensure confidentiality. That's the way to succeed. Leading by example and motivating them. And then it's important to know that FDA has not approved nicotine replacement therapy for kids or young teenagers, younger than 18 years. But there is AAP does say you can consider off-label NRT prescriptions if they are moderate to severely addicted and are motivated to quit. So what are the other programs that are available for kids to quit? So the Ohio Quit Line, this is the website here. It is available to all residents of Ohio, 18 or older, and younger also with parental permission. And the main thing is ask about vaping, advise them, and refer. So patients are twice as likely to contact the Quit Line if they are referred. And then what the Quit Line does is there's a lot of phone coaching, email or text, medications based on age, personalized planning and educational materials, membership in an online community, and clinical oversight. So there should be a lot of participation from the student or like the teenager to benefit from this. Among adults, this has been very successful. So 37% responder quit rate when they used coaching plus the NRT, and a 90% participation satisfaction rate. So the next program is called the My Life, My Quit, which is an online coaching program. So here you have the best practices for youth, tobacco and vaping cessation, along with coaching by live text messages or online chat. And this includes educational materials created by teens for teens. So they speak the same language, which is very good. And then the coaches who are trained, they listen, they provide personalized support, and they help navigate social situations, coping with stress, all for the same goal of helping this teenager quit. The third program that is available is called This Is Quitting, and this is part of the Truth Initiative. Again, this is free and anonymous text messaging, and it incorporates practical tips from other youth who have tried and now have successfully quit e-cigarettes. And the very evidence-based strategies to quit and stay quit. And this is a very tailored, personalized program. And you can just, a kid or a teenager can access this by texting Ditch Jewel to the specific number. So are there any health disparities in tobacco use and in access to quitting resources? So unfortunately, the answer is yes. So if you look at this table, you can see that this is 4 different ethnic groups: non-Hispanic white, non-Hispanic black, Hispanic, and other. And we are comparing the use of e-cigarette, cigarette, or cigar, so ever use of these products. So you can see e-cigarette is definitely higher among non-Hispanic white. So overall, according to the CDC, the non-Hispanic black tobacco use is lower, but the morbidity is much higher. Tobacco use is unfortunately the #1 cause for preventable deaths among African Americans and claims about 45,000 lives annually. This includes adults. So among children, they are more likely to be exposed to secondhand smoke, which we have seen in our clinical experience. So when we try to discern what is the product that this community is using, it is the highly addictive menthol, cigars or cigarillos. And 85% of African American smokers use menthol products. So this is a very strongly addictive product. And so this is, so it makes it less likely for them to quit. So why is this happening? So there is clearly data available that there is targeted marketing. So depending on the location or the area where there's a minority community. There is a lot of push to use menthol-related products. And then whether it is also socioeconomic related because of e-cigarette costs versus cigarette costs. And then there is definitely limited access and limited resources to quit. So even this is an unfortunate situation that there is a disparity in tobacco use and the access to quitting resources. And then lastly, as pediatricians, what resources can we offer parents of children who vape or who are exposed to tobacco products? Communication is key. So as with anything, prevention is better than cure. A proactive, open communication. So even talking to them before they start vaping. Leading by example. So it's mainly like if there's a smoker in the family, there's very high likelihood of a child or a teenager smoking and less likelihood of a kid quitting. So denial could be detrimental. So why I say that is even in our clinics, we do see that parents are like, no, my child doesn't do it. But unfortunately, sometimes this is not true. It is very likely that a teen is aware or exposed to e-cigarettes. So we can ask the kids confidentially, separately about their use. And sometimes we get an answer, sometimes we at least get them thinking. So this is a very good website from the CDC, which is the Talk to Your Teen About E-Cigarettes and a tip sheet for parents. It's like before the talk. So how do you prepare yourself, equip yourself with some information about the vape products, start the conversation, answer the questions related to like what will happen health-wise, what will happen if I quit, where will I go, things like that, and then keeping the conversation going. So that is going to be very important. And the main thing is it is never too late to talk to your kids about vaping or quitting. So how can parents identify vape use? So according to the CDC, unusual fruity odors or vape clouds that they can see, recognizing the discrete vape devices, which look so much like USB devices, and then identifying mood changes, irritability with vape use and or withdrawal, and then declining school performance. And again, this is a good website, e-cigarettes and youth, what parents need to know. Parents can also refer their children or like the teenagers to the Ohio Quit line or the My Life, My Quit. So there's a questionnaire that they need to answer and then refer. As mentioned again, referral does improve success rate. So they're very, very direct and like, how do I talk to my child? How do I help my child? How do I know if my kid is vaping? What can I do? So I think the main thing is it's a lot from our side, it's knowledge with partnership with the family and the child, and then a lot of patience. So this is in a non-confrontational way. If we talk and have a systematic plan on how we're going to achieve this, this is going to result in successful and sustained victory against vaping. There are multiple online resources, but the big ones are, of course, the CDC, Campaign for Tobacco-Free Kids, FDA, Ohio Department of Health, Truth Initiative has great videos, the WHO, American Lung Association, from the AAPs, the Julius Richmond Center for Excellence. We talked about the Real Cost Campaign, National Institute of Drug Abuse, including housing and urban development. And then we have like CHEST and American Thoracic Societies, a lot of information available. So lastly, I think I wanted to just end with this, this very inspiring picture. So we cannot force someone to hear a message that they're not ready to receive, but then we should never underestimate the power of planting a seed. So I think that's something we can all take away from this talk. And then we are all in this together, even though we are 6 feet apart. So I am very, once again, thank you for this opportunity to talk to you today. And I hope you, if you have any questions, please put it in the chat box. I'll be happy to answer. And I'm at Nationwide Children, so if you need to contact me, please feel free to contact. Thank you once again. Bye.